Welcome to Impact Signals, social impact at the scale of AI. I'm Charlie.
And I'm Sarah.
It's Thursday, March 5th, 2026. This is episode 21, and today's theme is the accountability reckoning. AI is simultaneously becoming more essential and more dangerous in humanitarian work, and the sector is grappling with both in real time.
Let's start with the biggest news of the day. The International Federation of Red Cross and Red Crescent Societies, the IFRC, released its World Disasters Report 2026 this morning, and they used words that the sector rarely uses in an official flagship document.
They called AI-amplified disinformation a de facto crisis, not a risk, not a challenge, a crisis, as operational and urgent as food insecurity or shelter gaps.
And they backed that up with specific operational incidents. During the 2024 Valencia floods in Spain, false narratives circulated online claiming the Spanish Red Cross was diverting aid to migrants. Those claims were AI amplified and spread faster than any fact check could travel. The result? Xenophobic attacks on Red Cross volunteers. Aid deliveries disrupted.
In Sudan, rumors spread that humanitarian organizations were distributing poisoned food. People in desperate need of nutrition assistance refused it. Local Red Cross staff faced physical threats.
In Lebanon, disinformation campaigns claimed volunteers were favoring specific ethnic groups. In a conflict zone where trust is already fragile, that erosion is operationally catastrophic.
The IFRC's position is that information integrity is now a life-saving commodity, as critical as water or shelter, and that humanitarian organizations can no longer treat disinformation response as a communications function. It has to be embedded in core operations with the same urgency as food security monitoring.
For practitioners listening, that means formal disinformation response protocols for your field teams. It means auditing your monitoring tools for false narratives specifically about your organization's operations. And it means that the funding case for community information programs just got a flagship evidence base behind it.
The IFRC is calling on technology platforms to prioritize authoritative sources during crises. Whether platforms respond is a separate question, but the sector now has the report to point to, which brings us to the second story, and this one is a counterweight. While the IFRC is documenting the risks, the International Rescue Committee published what may be the most detailed operational blueprint yet for deploying AI responsibly in exactly those same settings.
The IRC released From Promise to Practice yesterday, March 4th. It documents 2 years of AI deployment across 30 countries, reaching more than 20 million people through their Signpost platform. But the centerpiece is a specific program in northeast Nigeria.
Northeast Nigeria, Borno, Adamawa, and Yobe states, 3 of the most conflict-affected regions in West Africa. The IRC deployed a tool called Apprendia, an AI-powered teaching assistant for educators working with displaced children in recovery settings. It runs on low-bandwidth messaging apps, no special hardware, no cloud dependency.
It started as a 400-person pilot. As of this report, it's reached 3,200 teachers. The IRC's target is 22,000 by the end of this year.
And the performance data is important to understand because it's honest in a way that a lot of AI success stories aren't. The system met quality standards roughly 75% of the time on its own. Staff productivity went up nearly 70%. But, and this is the key finding, human review is still required before responses go out.
The IRC built what they're calling a human-in-the-loop architecture. AI drafts, humans review before distribution. They didn't claim the AI was autonomous or self-sufficient. They documented exactly where the human handoff happens and why.
The broader lesson from the IRC report is what they call contextual intelligence. In humanitarian settings, a tool that works in local languages on existing low-tech devices is more valuable than a more sophisticated model that requires bandwidth and hardware the field doesn't have.
They also open-sourced the underlying platform. Signpost AI, built with Google.org, Zendesk, and Cisco, is available to other humanitarian organizations as an agent-building platform. If you're working in protection, refugee services, or anti-trafficking, this is infrastructure you can actually use, not just a case study to read.
Story 3. UNICEF published new data today that quantifies something that's been building for months.
1.2 million children. Across 11 countries, UNICEF is reporting that 1.2 million children had their images manipulated into sexually explicit deepfakes in the past 12 months. They're calling it a direct consequence of mass-available image generation AI tools.
And UNICEF's policy demand is specific. First, governments need to update their laws. Most current CSAM, child sexual abuse material, statutes only cover images of real children. There's a legal loophole for AI-generated imagery that many jurisdictions haven't closed.
Second, AI developers need safety by design standards, not content moderation after the harm is done, model-level prevention that stops these images from being generated in the first place.
For practitioners running AI tools in schools or child-facing programs, this is a procurement and governance checkpoint. Are the AI systems in your programs audited against safety by design standards? If that's not in your vendor agreements, it needs to be. Fourth story is a critical warning for anyone in the field evaluating AI for health support. Researchers at the Icahn School of Medicine and Mount Sinai published a study in Nature Medicine this week testing ChatGPT Health on 60 standardized patient scenarios.
The result, the system failed to correctly triage 52% of serious medical emergencies, cases involving diabetic ketoacidosis, impending respiratory failure, early signs of suicidal ideation. The AI frequently advised patients to wait 24 to 48 hours rather than seek immediate care.
52%, more than half. And this is a commercial AI product specifically marketed for health support.
The humanitarian application here is direct. Organizations using AI chatbots for remote health support in inaccessible zones, field sites where a doctor isn't available, cannot treat AI medical triage as autonomous. A clinical escalation path is not optional. It's the minimum viable safety requirement.
The 52% miss rate should be in your AI procurement policies and your grant applications that require evidence-based risk assessment. It's now peer-reviewed, published in a leading journal, and it's directly applicable to how you evaluate health AI tools.
Story 5, the United Nations. On March 3rd, 40 independent scientists convened for the first meeting of the Independent International Scientific Panel on Artificial Intelligence, a body confirmed by the UN General Assembly to provide assessments of AI's impact on economies and societies.
The mandate is designed with a specific independence guarantee. The panel operates free from influence by any government, company, or institution, including the UN itself. Secretary General Guterres told the panel they are a race against time, acknowledging that AI is advancing faster than governance frameworks can track.
The practical implication for practitioners, this panel will produce the scientific assessments that directly feed international AI governance frameworks, the frameworks that determine data sovereignty requirements, bias accountability standards, and humanitarian data protection rules that your organization will need to comply with.
Monitor the panel's outputs. They're the most credible source for evidence-based advocacy on the governance questions that will shape this field over the next 2 years. And we close with a story from East Africa. Anthropic and a government of Rwanda signed a 3-year Memorandum of Understanding, one of the most comprehensive bilateral AI partnerships between a frontier AI company and an African nation.
The partnership covers 4 areas: health, education, economic development, and, notably, digital sovereignty. On health, AI-assisted tools targeting cervical cancer elimination, malaria reduction, and maternal mortality. On education, deployment of an AI learning companion called Chitty across 8 African countries, plus 2,000 Claude Pro licenses for educators.
The sovereignty piece is worth examining. The MOU includes explicit provisions for Rwanda to maintain meaningful oversight and data governance, not just consume AI services built elsewhere. Anthropic is positioning Chitty as having been designed with local curricula and local languages as primary design constraints.
There's active debate in the tech for development community about whether this represents genuine capacity transfer or creates new forms of AI dependency. That debate hasn't resolved, and it shouldn't be dismissed. But the structure of this agreement, with sovereignty provisions and local design requirements, is a model other organizations can reference when structuring their own AI partnerships in the Global South.
If you're working in African health or education programs and evaluating AI partnerships, the Chitty deployment framework is worth examining as a design reference.
And before we go, upcoming events. Next week, Humanitarian Networks and Partnerships Weeks, March 10th through 12 in Geneva, hosted by UN OCHA. There are specific AI sessions on applying research in humanitarian practice and centering local leadership in AI development. If you're in Geneva, this is the right room to be in.
March 16 through 27, EU AI Week in Brussels, with a hackathon focused on sovereign AI tools for public administration, critical for organizations with European operations navigating the EU AI Act.
And March 30th through April 2nd, the IAPP Global Privacy Summit in Washington, D.C., the world's largest forum on AI governance and data privacy, for compliance and legal teams working on humanitarian data protection.
That's Impact Signals for Thursday, March 5th. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.